I'm Dr. Timothy Johnston with your post-operative instructions for a routine filling. This would be a composite resin filling that you're having done today in modern dentistry, the tooth-colored fillings in other words. Now there's some things you should know, especially if you start to develop any complications. Number one, be careful of a numb lip. I've seen a lot of people, especially kids, bite their lip because it was numb and they didn't realize it. So please avoid chewing anything that's going to feel like a meaty substance because it might just be you. In other words, your lip. So be very careful of that. You can resume normal eating on our fillings as soon as it's comfortable though. These fillings are as hard as they're ever going to be the moment you step out of our office. So feel free to resume your normal diet as soon as you want to. When you're numb and we have you check on the articulating paper, that little blue paper that you bite up and down on, we're checking to make sure that that tooth fits in the bite with the rest of the teeth. Occasionally, when you're numb, you don't always bite straight or bite with the normal way you bite. So if the numbness wears off and you notice that something feels a little different in the bite, please don't wait for it to wear down. The composite resin fillings we placed today are so durable, it's not going to wear down. You're just going to get a toothache. So please call us right away. We'll get you right back in and make any adjustments we need to once you can kind of feel your bite the natural way you normally bite down. Lastly, if you're experiencing any temperature issues, if cold or hot really bother that tooth, give it a couple of days. That's not terribly unusual. After all, we've traumatized that tooth a little bit. When we put a drill to it and work with it, spread chemicals and all that, it is normal for a tooth to feel a little bit off for a few days with temperatures. But if it's an outrageous feeling, please call us right away. If you had an especially deep filling or if there was underlying damage to the tooth before we got there that wasn't detected under normal x-rays and visual exam, then the nerve may be in fact going. In other words, the nerve may be dying and you might be looking at a root canal procedure in the future. Not to scare you, but it would be the right thing to do to come in and get that looked at if that cold or hot sensitivity seems to be lingering on for more than a couple of days or if it seems to be outrageously tender. So that's what you need to know about fillings. Thanks for watching.